threatens her job if she were to tell anyone the truth about abortion. There's something wrong with that picture. There's something wrong when they would take a non-credentialed woman and allow her to go into the surgical room with the physician and then send her in the back to count body parts. There's something wrong with that. In direct opposition to the informed consent requirements in many states, Planned Parenthood has joined other abortion providers to keep Black and Latino women from receiving any information or assistance that might help them choose life. There are more than 2,500 pregnancy centers in the United States that provide free pregnancy tests. They give free ultrasounds and a host of other services in a continuum of care. Planned Parenthood and others have called these centers, quote, fake clinics. One example of their activist opposition happened at a Human Coalition Center in Atlanta, Georgia, where I live. I'm going to ask Reverend Dean Nelson, Human Coalition's National Outreach Director, to come and tell you about what happened in Atlanta. Reverend Nelson.
Thank you, Catherine. How many of you know that it is, while our culture says that this is a women's issue, it is important for men to be able to stand up to protect our wives, our daughters, our nieces, and other women within our community? Can I get an amen? I'm proud to stand on behalf of Human Coalition, as well as the Frederick Douglass Foundation and the Douglass Leadership Institute. We believe that this issue is a justice issue. Frederick Douglass once said that I have one great political idea. The best expression of it I have found in the Bible. It is in substance, righteousness exalts a nation. Sin is a reproach to any people. That's the whole of my politics, he says, the positive and the negative of my politics. When I was a student at the University of Virginia, I remember walking across the lawn, and there was a young lady who was sitting behind a small booth. And I went over to find out what she was promoting. As I went there, she gave me some information, and she told me that she was actually there helping students to understand about abortion. I told her, but she asked me what I thought about abortion. I told her that I didn't have very much thought about it, except the fact that it was legal, so what was the problem? She looked at me and she said, well, wasn't slavery in America once legal? And that put me on a course to reevaluate my whole thought process, biblically as well as culturally and historically, about this issue. As Catherine stated, I serve as the National Outreach Director for Human Coalition. And I'm going to talk to you just for a few moments about what I like to call the billion-dollar lie. Because the reality is that this issue is an industry, and it does not like any form of competition. I recently read the story of a powerful young woman named Timely. She said, I was 14 years old when I found out that I was pregnant. I knew that if I told my mom, she would be upset. But when my mom found out, she told me that I was going to get an abortion. She took me to an abortion clinic. They didn't ask us any questions. They just told me how to schedule an appointment and how much it would cost. A little intimidated by the price, my mom thought that we would actually look around. She called and made another appointment for that abortion. A few days later, my mom took me to that clinic and we paid $470 for the abortion. She was not allowed to come into the back room with me, so I walked through those doors with strangers. I felt scared and completely alone. They did a quick orientation and they told me what they were going to do, and then they did an ultrasound. They kept the machine turned away from me so that I could not see what was on the screen. Then the doctor came in. But before they started the procedure, one of the women from the clinic spoke with the doctor, and then they instructed me to put my clothes back on. They told me that the ultrasound showed that I was much further along and that I was going to have to go back and get more money for this quote-unquote necessary procedure. When I got back to the waiting room, I told my mom what had happened. She got up, she went to the registration desk, and a few seconds later, she turned around and told me that we were leaving. I was so relieved. She did not ask for her money back. She just grabbed my hand and we left. She kept telling me how sorry she was. Later, she told me that she had seen the picture of the ultrasound of my baby in a file on the desk. The following week, we went to a local pregnancy center. They were anxious to help us in any way that they could. They offered me maternity clothes, a crib, other material assistance for me and for my baby, and lots of referrals to other local agencies. I am so thankful for everything that they did for us. On January 7th, I gave birth to Damien. He was 2 months premature and weighed only 2 pounds at birth. But God saw us through it, and today he is 6 months old and completely healthy, receiving all the love and attention that God had ordained for his life. This story has a positive ending. However, the harsh reality is that most young women, particularly minority women, are targeted by this multi-billion-dollar-a-year enterprise that skillfully and deceitfully markets and promotes itself as being for women's health. The real reality, however, is far from the truth. Not only is abortion an often cold, somber procedure that extinguishes the life of a tiny human being, it also robs women of their dignity. An article in the American Journal of Obstetrics and Gynecology revealed that black women and other minorities who receive a disproportionate number of abortions compared to white women, and are also 2.5 times more likely than white women to die of an abortion. It's no wonder that 81% of women surveyed in a study reported by the Journal of Social Issues said they felt victimized by abortion. They also stated that they felt coerced into an abortion, or that information regarding alternatives to the actual procedure had been withheld from them. Women continue to be manipulated, misinformed, hurt, and die largely because this huge, under-regulated industry that coerces women, making billions of dollars, promotes themselves as women's health. The Alan Guttmacher Institute, research arm of Planned Parenthood, estimates that there were about close to 1 million abortions performed in the United States in 2016, and the average cost of a first trimester abortion was roughly between $300 and $900. A second trimester abortion could cost between $1,200 and $2,100 or more. A third trimester abortion could cost up to $5,000, and yes, third trimester abortions are still legal in this country. That means that each year in the United States, the abortion industry brings in approximately $831 million through Planned Parenthood does through their abortion services alone. If you add this to the over $300 million or more Planned Parenthood receives through the federal government and government grants and contracts, that figure is well past $1 billion. A friend of ours, Carol Everett, stated it this way. She said in an interview that when she was an abortionist, they didn't care about women's health. They had a whole plan to actually do abortions. She said that she wanted to become a millionaire. She said, we had a whole plan for abortions. It was to enter into the young woman's life, become the sex expert in her life, separate her from the morality of her parents, and ultimately get several abortions out of every young woman that came through their schools. Nowhere has this plan been more strategically implemented than in minority areas. Consider Dr. Laverne Tolbert, a former board member of Planned Parenthood in New York City. She said it like this: I have seen firsthand that women in communities where blacks reside have been strategically targeted for abortions by Planned Parenthood. Children who attend inner city schools are sexualized at a young age through their school-based health centers and comprehensive sex education classes. This part of their manipulative scheme needs to be exposed. While the pro-abortion advocates often say that they want to reduce unwanted pregnancies and abortions through sex ed and contraception, they conveniently ignore the fact that legalized abortions and hormonal birth control lead to higher rates of STDs. And sadly, STDs are in epidemic levels across the nation, particularly in the African American community. The CDC states that there are nearly 50% of African American teenagers are actually infected with some form of STD. Perhaps the most shocking recent trend in the abortion industry, however, is not only that they push abortions on those Black and Latinos in urban communities, but they attack any organizations that provide alternatives. Over the past few years, the abortion business and their lobbyists have teamed up with pro-abortion legislators to produce unconstitutional disclaimer bills in several states like Maryland, New Mexico, Oregon, and Virginia. And while most of these bills were unsuccessful at the state level, the industry was not deterred. Searching for success, they turned to cities like Baltimore, New York, Austin, Texas, to push for city councils to actually pass these ordinances that would put heavy fines and regulations on pregnancy resource centers and women's clinics like those that we have through Human Coalition. Pregnancy centers, they want to push them out of business. These laws would place heavy fines as stated. If most abortions occur in the urban sector, the abortion clinics in those areas are simply protecting their bottom line. And sadly, the pregnancy centers and women's clinics that provide these free services, ultrasounds, pregnancy tests, counseling, and material assistance to women it's needed most in these communities. But according to NARAL Pro-Choice, these attacks are not isolated incidents, but a premeditated plot to attack only pregnancy centers in urban communities providing resources for minority women. A report on pregnancy centers and women's clinics in 2010 demonstrated that these centers serve over 2.3 million people a year. They provide a variety of services at little or no cost, and it is estimated that their total cost savings to our community is over $100 million. While abortion advocates call themselves pro-choice and pro-women, it is clear from their tactics that they are not. This billion-dollar, under-regulated industry wages the real war on women, and they are more concerned about protecting their financial interest than they are about protecting women. By contrast, the growing number of faith-based ministries and pregnancy centers that provide alternatives to these providing alternatives continue with the helpful services to bless women in their communities, whether it is abortion recovery programs, parenting classes, abstinence education, STD testing, ultrasound services, or medical exams. These women's clinics are providing community support, and as reported by Time magazine, they are becoming the kind, non-judgmental face of the pro-life movement. I want to take a few closing moments to share with you. The Supreme Court right now is going to make a decision in the next month or so regarding a case that many of you have heard called an organization, NIFLA. It is regarding protecting these pregnancy centers that provide these resources. I want to invite you to pray for that case, because it has been shown that these ordinances that they try to push to close down these life-affirming centers is unconstitutional. But we need, at the highest level of our land, for the laws to protect these centers that are providing these vital needs, free services to the women who need them the most. A few years ago in the city of Baltimore, I stood there before the city council. And Planned Parenthood and the abortion advocates could not produce one person in 20 years that had found reason to distrust any of the pregnancy centers that we were working with. Not one. But yet they marched in paid staff to say that the work that these pregnancy centers were doing was unconscionable and was deceiving women. Now you trust me. Do you listen to the voices of women who have gone through those centers, who 97% of the time say that they were blessed and that they would refer other women to those centers? Or do you listen to the paid people who want to keep abortion pushed in urban communities? I've seen firsthand, just as Catherine stated last year, when Human Coalition Women's Clinic, that was now doing incredible work, saving record numbers of children, was all of a sudden attacked. They didn't attack the centers that were out in the suburbs, but they attacked the centers that were right in the heart of Atlanta, providing services. Why? They did it because every time that one woman chooses to come in and to save her child, that's $500, $1,000 that they don't get. So I want to invite you to pray and to stand with our nation's pregnancy resource centers and women's clinic in urban communities that are providing these life-affirming resources, and to encourage the Church of God to stand with them so that we can see the end to this scourge. Enough is enough. God bless you.